Hi, I'm Droppert, the owner of Montebello Physiotherapy Clinics, and I'm here at BHI to talk to you today about ankle sprains. One of the most common injuries that we'll see at our clinics is an ankle sprain, where the foot either rolls outwards or more commonly inwards and creates pressure which tears the ligament on the outside of the ankle. Typical strategies to manage this would be your RICE strategy, where you use rest, ice, compress the area, and elevate it for a few days as the symptoms settle. At Physio, which we do to aid this process quicker, we'll use ultrasound, which breaks up some scar tissue, brings blood flow to promote that healing quicker. Electrotherapy, which just helps with pain control to get through those first few painful days. As well as taping to get out of those uncomfortable positions, or suggest a brace that can be used in sport so you can get back there quicker. We also will bring you through a series of strength exercises. Typically what we'll see that happens poorly when people don't rehab these is for months or weeks later. Even I've seen years where people don't have that balance awareness or strength in that joint. What people typically do wrong if they neglect to rehab the joint is they won't have that and you'll see that they don't have that balance or awareness in that joint, and they're more likely to roll their ankle again. What we will bring people through the process of learning that sense of awareness to that joint, which we call proprioception. So we bring them through range of motion exercises, strengthening, or a band where you bring your foot both inwards and outward to get that strength, as well as functional exercises.